Hello and welcome. This video is a few stretches to help a specific client who has rheumatoid arthritis. And the goal here isn't to get rid of rheumatoid arthritis, it's to try and help release and make muscles a bit more flexible to reduce pain. So we're going to run through just a few stretches for you. And the first one, we are sitting down, okay, against a wall with our legs out nice and straight. And the first part of this is to try and get your bum as close to the wall as you can. And what this is doing is it's stretching the back of the legs, so the hamstrings and the calves. And the goal here is to not let your feet turn in, try and keep them out the way a little bit, and try and sit up as straight as you can with your bum as close to the wall. Then all we're going to do is we're going to try and point our toes towards our nose, so back the way like so, and then reach forward to try and touch our toes. Now I can touch my toes just, but that's super, super tight up the calves, the back of the knee, and the hamstrings. And wherever you feel it is going to be the bit that's the most tightest, that's the tightest for you, okay? So we're going to keep going that, and we're going to try and do it for a minimum of 15 seconds and hold, okay? And that is pretty much that, okay? The best thing to do here is to try and really push it and not let go until the 15 seconds are done. You're going to want to, because for some of you this is going to be really quite painful and very uncomfortable. But try and stick with it, minimum of 15 seconds, 30 if you can, or even just build up to that. The next stretch is, we're just going to move slightly away from the wall. You're going to bring your left foot up to your right thigh. You're going to go right hand to right toe, and then you're going to bring the opposite hand, okay, left hand all the way over to the right toe as well, and be right over, trying to get your chest over that quad or that leg and thigh just there, and try and hold it there, okay? And you're trying to be as centered with this as you can. Point your toes to your nose and hold it. Really, really try and get that chest closer while you pull that towards you. Don't just relax into it. Really, really try and push the stretch and hold it. And again, minimum of 15 seconds, 30 seconds if you can, and then you're going to switch over and do the same with the other one as well. So right foot to left thigh, left hand to left toe, over the top, and then gently pull as you go. Now once again, this could be quite painful. If it is painful, that tells us that it's quite tight and needs to be stretched, because if this is tight here, it's probably going to be pulling on here. If this is tight here, it's going to be pulling on here. So it can relate to sore hips, sore knees, sore ankles. Sore back is a really common one as well, in particular lower back. It can go higher as well, but lower back is one we've seen a lot. And this is just going to help release that tension a little bit. The next stretch, you're going to put the soles of your feet together, and then you're going to try and bring the soles of your feet as close to your bum as you can. Try and stay as upright as possible, okay? Bring them as close to your bum as you can, and then as you lean forward with your elbows, just place them on your thighs and try and lean forward and push them down towards the ground. This is for the groin, okay? And it's just going to hopefully release any tension. If your knees are right up here, that tells us that that part, the groin, is super, super tight. So just keep trying to push down and get closer and closer with the chest down to your feet. And then hold it minimum 15 seconds to 30 again, okay? And then relax, okay? The next one, okay, is going to be for our bum. All right, so what you're going to do, I'm going to turn slightly to the side so you can see this. You're going to lie back on the ground with your knees bent. Then you're going to put your right foot on your left knee. Then you're going to put both hands around your left thigh. One through the middle of your legs, one round the outside, and then you're going to pull that back towards you and hold here. This is going to stretch your bum on this side here. And then with this right knee, okay, with the knee that's sticking out, you're going to take your right hand out and pull that knee back towards you and just hold it there. You may feel this a bit more in your groin, but should feel it in your bum. Again, 15 to 30 seconds, okay? 15 being the minimum, 30 being the ideal, and keep going and keep stretching. Good, good. Pull that in and then relax it. You're going to do the exact same with the other one. So left foot onto right knee, both hands around your right thigh, roll back and pull towards. Again, this knee that's coming out, we're feeling it here. We're going to pull that in again, and you may feel it in your groin here again. And this knee here has been the guiding force. So the more you pull that back, the more you're going to feel the stretch, and you want to feel it. Again, if it's particularly painful, then it's just a little sign that it needs a good stretch. The 100th time you do this, it won't feel nearly as bad. The first time you do it, it might feel quite tough, and then relax there. onto the next stretch. The next stretch is also for hamstring again, because hamstrings is one of the strongest muscles in the body. And if we're in a seated position, almost like I am right now, this hamstring, which is from the back of the knee to the bum, will just get tighter and tighter and tighter. And this has the ability to pull on everything. Again, could be sore knees, could be sore lower backs, could be numerous little aches and pains. And this tends to release it a lot. So in a seated position, I'm using a box here, but you could do it on a chair or anything. Knees slightly bent, you're going to go right leg dead straight, okay? Then you're going to get your left hand and you're going to go over and try and pull that toe towards your nose with your hand. If you can't do this, you could use a towel, or you just point your toe down and you're trying to get that hand as far down as you can. But it's really important that we keep this leg straight when we do it so that you get that proper stretch. And it may be your calf you feel it in, it may be your hamstring you feel it in, but it's doing great job at just releasing a lot of tension that is in those muscles that I just spoke about. And then after 15 seconds minimum, 30 seconds ideal. Same with the other leg. Over the top. Good. And then same again, you can bring that hand over there as well. But we always use the opposite hand. So if it's left leg that's straight, right hand comes over. You can use the other hand just for a bit of support. And then that is that one. Now the last stretch that we're going to do here is for the quad. So we're going to stand up. And when I'm using this here, you could do this on a chair or a bench or even a table. But the goal is to basically get this foot up onto this position here, okay? And it's so that it makes it easy to grab the foot. So from there, I can grab my foot and then pull it up to this position here. Now you're going to try, that might be sore enough or really difficult for anyone to do, and you may be kind of hunched over. If that's the case, you're just going to do that. You're just going to lean back on whatever it is that you're sitting in order to stretch this muscle here, and that's what pulling this up does, okay? Now if you can do that, no problem. You may want to hold on to something as well, okay, just for balance. But if you can do that, no problem. You want to grab your foot where your laces are, bring your knees together, and you want to push forward with the hip, and at the same time, push your foot into your hand, okay? Push your foot into your hand, and then hold it for, again, minimum of 15 seconds. 30 is ideal. And then you also want to repeat that on the other side. So we use this step, or the box, or the chair, or whatever it is you want to use. Put your hand underneath. Grab where your laces, you put your hand where your laces are, knees together, push forward with the hip, and then that is that. So I hope you found this helpful. Remember, this isn't a cure for rheumatoid arthritis. What it is it's just to help release a lot of tension in the joints where that may occur. This will also help loads of other things, like if you've got like little niggles like sore knees, ankles, hips, lower back, it can also help reduce pain in those areas if done on a regular basis. We also want you to try and do this maybe 2 or 3 times a day if you're suffering from these niggles, and then you can maybe do it a little bit less as these get a little bit better. But if you could do this every day, twice a day, you will see huge differences in mobility, ease of pain and flexibility, and the ability to do more throughout your day, because that's what it's all about really. Hope you enjoyed it, have a good one, and chat to you soon.